again on the same topic, mixing and matching multifocal lenses, the results of an open European online project. Fine. So what's the trend? We discussed it beforehand, bilateral implantation of the same lens in each eye, mixing and matching different multifocal lenses. The trend, one of the trends is staged implantation. Watch how the first lens performs and then decide on the lens for the second eye. We've seen, we discussed the Technis lens, it's a refractive lens now, a diffractive lens, now it comes as an acrylic version, and we have been using it also as a silicone version. In reality, it's 3.2 diopters at the spectacle plane. The resume is a refractive lens, hydrophobic acrylic. What is Custommatch? The patient lifestyle should determine the choice of the lens. We can customize it. And again, we have the choice between 2 diffractive lenses, 2 refractive lenses, or the mix of both principles. In this project, in this prospective online internet documented study, the mix of both optical principles was studied with the Technis in one eye and the resume in the other eye. How did it go? Choose the first lens according to the patient lifestyle, see how the first lens performs, and get the patient's feedback. And then you can go for the same lens for the second eye, or you go for another lens. And that's the combination, that's the customized approach. And we are talking about, we will discuss outcomes of the combination of these 2 lenses. We have discussed that also before, and was it done before? Yes, it was done before. Our brain can adapt it. The results, the outcomes, mixing several multifocal lenses were excellent and good. And again, Akashi and Fabri, enormous experience. Their outcomes were excellent. Lopez-Castro outcomes. Additional studies, 100% spectacle, independent. In my small study, Cardini did it, Dr. Rao did it in Germany. Asaf obtained 92% spectacle independence, combining the 2 lenses. What is the European Mix and Match project? It's a web-documented project, web-documented results. Multifocal lenses, resume in one eye, Technis in the other eye. Follow-up as usual, major endpoints, uncorrected, best corrected, etc. Independence of glasses, reading speed and reading acuity. The participants, private centers, university centers, international centers, Italy, Germany, Spain, and Belgium. Project end status, we started that in June 2006, 12 surgeons, as you have seen, 234 patients, follow-up 3 months, and the study completed after 6 months, 65%, 152 patients in the study, and that we closed the study at that time. Patient demographics, there are refractive surgery patients as well as cataract patients. You can see the age range, 40 to 80, the gender, females, males, the target refraction, most of the time it was emmetropia. In the hyperopic refractive surgery patients, we had hyperopia till 6-8 diopters. We did not do refractive lensectomy, and the surgeons in the group had the same attitude. Refractive lensectomy for hyperopia is possible even if they are 40 years. When they are +5, +6, they will be extremely happy, because we have never seen a retinal detachment after YAG laser in a high hyperope. We will not do it for myopes unless there is some cataract of some incipient cataract. And we have also some high myopes in the study. I've done several -10, -12s. Also, these patients were extremely happy. But these were not a real cataract, but they had some kind of cataract of lens clouding. We would not include a clear lens with a high myopia in the study. Pre-op data, of course, some of them had some symptoms, 25%, as you could expect, because there were many cataract patients. Dominant eye. The lens implanted in the dominant eye, as it seems logical, is the resume lens, 94%. The lens power, we had powers up to 32 diopters. Capsular axis, it was discussed. Most of the time it was centered, but even if your axis is not centered or there is some small displacement with these lenses, there were no significant outcomes concerning a loss of acuity or whatever. Pupil size, pre-op and post-op, again as expected. Post-op it became a little bit smaller, nothing specific. Decentration, no real important decentration, but even if it was there, decentration and tilt, it did not disturb the outcomes. Post-operative results. It's important to see that the post-operative results improved over time. This is day 1, 0.8, 80%, 1 month, 95%, and 4 months, 100%. Again, for the uncorrected near vision, using this combined approach, some improvement over time. Reading acuity, the reading speed was extremely good. We took as a standard the reading speed mentioned by Huets in his paper a few years ago, and in our group, even mesopic and photopic, our reading speeds were higher. So the function, the quality of vision, the function of the functioning quality of the lenses was extremely good. Visual symptoms, again, photopic phenomena, it exists, but severe only in one patient. So 25 or 30% 25 or 30% had some moderate problems, but very severe problems, very, very exceptional. Probably the patient selection was done very well in this group. Independence of glasses, and around 90%. And when they needed glasses, 3 of them needed it for distance, bifocal spectacles, very exceptional, and 2 of them needed it for reading. Others, some of them needed the glasses, sunglasses. Some of these patients are disturbed by the light. Some can be helped by giving them a prescription for tinted glasses. They will have less hail and glare, although they will see less at night. Some of them are happy, and probably these are the 2 patients who had to wear sunglasses when they wanted to drive at night. Again, the same question, would you undergo the same procedure again? Nearly 100% of the patients is this, and this is a prospective, online documented study, 99%. Same question, would you recommend this type of surgery to your friend? Extremely high positive answers, 93% of the patients said they would do that. So in summary, mixing of these lenses at a high degree of spectacle independence and patient satisfaction. And again, I repeat, this was a prospective study, several different centers, 12 surgeons. Functional vision, also the reading speed was excellent. Halos are inherent symptoms in multifocal lenses, about 30% had them, but most of the patients did not feel significantly bothered. Maybe 1 or 2 patients hated driving at night at the outcome. It's a valuable option for a personalized multifocal vision,